A very pleasant morning and hearty welcome everyone to National Webinar on Orientation on Graduate Pharmacy Aptitude Test and Career Prospective in Pharmacy Profession, organized by Department of Pharmaceutical Analysis, Nirmala College of Pharmacy, Mangalagiri, Andhra Pradesh, in association with APTI, AP State Branch. It's my immense pleasure to give brief introduction about our college. Nirmala College of Pharmacy is established and administered by the Society of Catholic Sisters of St. Anne's, Hyderabad. It is a self-financed institution and also affiliated to Acharya Nagarjuna University and approved by AACTE and Pharmacy Council of India, New Delhi, and also accredited by NAC and approved UGC 2F and 12B. Our institution is acquired All India NIRF rank 78 to 100 band since 2017 to 2018. Our institution offering courses like D Pharmacy, B Pharmacy, M Pharmacy with 3 specializations: Pharmaceutics, Pharmaceutical Analysis, Pharmacology, PharmD, PharmD Postbaccalaureate, PhD with various infrastructures to provide best quality of pharmacy education. I feel proud to say that Nirmala College of Pharmacy always took as a pioneer in conducting various useful and informative national and international conferences and webinars. Our institution received Best Eco-Friendly Award from Acharya Nagarjuna University for the academic year of 2019 and 20. Our institution also established Nirmala Innovations and Incubation Center in the year of 2018 to strengthen the research and development. I feel happy to share you that our institution received grants about 60 lakhs worth from various government organizations such as AICTE, DST, ICMR, TB Association of India to enhance the infrastructure facilities to build up career-oriented skills and soft skills. The Department of Pharmaceutical Analysis has published 93 research articles in various Coopers and Web of Sciences journals, and also having overall ResearchGate score is 71 and Google citations 925 and also H index is 34. The Department of Pharmaceutical Analysis has published overall 12 patents till to date. The Pharmaceutical Analysis Department has received grants from like PMKVY, DST, ICMR and TB Association of India. The department actively participated in various national and international conferences and webinars organized by Nirmala College of Pharmacy. Our department staff members authorized 6 textbooks in the field of pharmaceutical sciences and also received various national level awards like Best Teacher Award, Bharat Excellence Award, Young Performance Award and etc. Now I invite Chief Patron of today's national webinar, Reverend Sister K. Sundari Garu, Provincial Superior, CSA Guntur Province, to convey her opening remarks.
Good morning to all. I am happy to know that our Nirmala College of Pharmacy is conducting a national webinar on the topic Orientation on Graduate Pharmacy Aptitude Test, GPAT, and Career Perspective in Pharmacy Profession. This is the need of the hour because many are looking for the right direction. I congratulate the Department of Pharmaceutical Analysis for organizing it in collaboration with APTI, Association of Pharmaceutical Teachers of India. My sincere appreciation to the resource person, Dr. S.K. Abdul Rahaman, the principal of the Nirmala College of Pharmacy, who is a man with greater commitment and vast experience. My best wishes to all the organizing committee and a fruitful and successful webinar to all the participating delegates. May God bless you all.
Thank you, sister. I feel delighted to invite patron of National Webinar, Reverend Sister P. Alfonsa Garu, Secretary and Correspondent of Nirmala College of Pharmacy, to give a welcome message.
I am very happy to know that our Nirmala College of Pharmacy, Atmakur, Mangalagiri is organizing a national webinar by the Department of Pharmaceutical Analysis in collaboration with the APTI on the topic Orientation on GPAT and Student Future Career in Pharmacy Profession. I appreciate today's resource person, Dr. S.K. Abdul Rahaman, Principal of our Nirmala College of Pharmacy, who has a vast knowledge on this subject, and all the department faculty initiated to conduct the webinar. I wish you all the best for all the delegates and outgoing students for the active participation. God bless you all.
Thank you, sister. I would like to invite Dr. G. Deval Rao Garu, President APTI, AP State Branch, and also Principal and Professor of Siddhartha College of Pharmacy, Vijayawada.
Good morning, one and all. Dear students and colleagues, we all know what is GPAT and its importance. It is a national level examination required for entry into Master of Pharmacy course throughout the India in all the institutions, including the reputed institutions like NIPER also. And the candidate who qualified in GPAT and got admission in a institution, you will get a stipend of rupees 12,400 per month for a period of 24 months. Therefore, definitely I can say that the GPAT exam is a very important exam, and in order to get qualification in that examination, we need what is called thorough preparation. For that, how to prepare, how to go through the examination, in what way we have to prepare for the examination. In order to tell all these important points, Professor Rahaman is going to organize this national webinar. I request all the students and faculty, young faculty also, get what is known as full acquaintance regarding this, what is known as the webinar. This
Thank you, sir. I extended my warm welcome to Organizing Secretary Dr. A. Shantakumari Garu, Professor and HOD, Nirmala College of Pharmacy, to speak about relevance of webinar.
Dear participants, as face of the organizing committee and on behalf of each one of them, it is indeed a very great pleasure for me to cordially welcome each one of you to national webinar on the theme Orientation on GPAT and Career Prospects in Pharmacy Profession, organized by Department of Pharmaceutical Analysis, Nirmala College of Pharmacy, in collaboration with Association of Pharmaceutical Teachers of India, AP State Branch. I am thankful to Chief Patron of this webinar, Reverend Sister K. Sundari Garu, Superior General of Caste Sisters of St. Anne, Guntur Province, and Patron Sister P. Alfonsa Garu, Correspondent and Secretary of Nirmala College of Pharmacy, for their consistent encouragement and support in organizing this event. I also thank Dr. G. Deval Rao Garu, President, APTI AP State Branch, and Principal, Siddhartha College of Pharmacy, for his cooperation and motivation for conducting this webinar. I would also like to thank convener and today's speaker, Dr. Abdul Rahaman, Principal and Professor, Nirmala College of Pharmacy, for sharing his valuable experience in this field, which he has gained through many years, and enlighten us with the latest information on the career prospects in pharmacy field. This webinar is organized to provide updated information, guidance, and training to the students for GPAT and awareness on the various career prospects in the pharmacy field for the benefit of the participants. We are trying our best to ensure that all participants gain rich information and make maximum out of it. Have a good day. My best wishes to you all.
Thank you, madam. I would like to invite Mrs. M. Prashanti, Assistant Professor, Department of Pharmaceutical Analysis, to introduce the chairperson of this webinar.
Good morning, one and all. Myself, M. Prashanti, working as a Assistant Professor in Nirmala College of Pharmacy, Atmakur, Mangalagiri, in the discipline of Pharmaceutical Analysis. I feel privileged to invite Dr. P. Venkateswarrao Garu, Principal and Professor, St. Mary's College of Pharmacy, Guntur. Dr. P. Venkateswarao Garu worked as a ratified principal by JNTU in Sri Sivani College of Pharmacy, Srikakulam. PG Director and HOD in Pharmaceutical Analysis in A.M. Reddy Memorial College of Pharmacy, Narsaravapet, Guntur. He had experience in the field of teaching for a decade and a half. He published more than 35 publications in different journals with good impact factor. I am happy to invite you, Dr. P. Venkateswarao Garu, as the chairperson for this webinar. Thank you.
Respected dignitaries and my dear participant, I am very much honored, I am very much pleased today the national webinar which is organized by Nirmala College of Pharmacy in association with Association of Pharmaceutical Teachers of India, APTI, AP State Branch. The topic of this today's national webinar, orientation on graduate pharmacy aptitude test, that is GPAT, and career prospectives in pharmacy profession, which is relevant to the all pharmacy graduates and young pharmacy and pharmaceutical. So I am very much thankful and I am very much honored the management of Nirmala College of Pharmacy and principal, convener and today resource person Dr. S.K. Abdul Rahaman, my friend and my mentor, making me as a participant in this national webinar. Nowadays, a lot of national webinar are conducting different colleges in our country. But this is very different national webinar, which is essential for final year B.Pharmacy graduate, and also that means the outgoing batch. It gives me immense pleasure to introduce today's resource person, Dr. S.K. Abdul Rahaman, Principal and Professor, Nirmala College of Pharmacy, Mangalagiri. Professor Rahaman presently working as a Principal Professor in Nirmala College of Pharmacy. He has 18 years of teaching and research experience in the field of pharmaceutical sciences. He has completed his B.Pharmacy from Nalanda College of Pharmacy, Nalgonda, which is under Osmania University in the year 2000. He got qualified GATE 3 times and his best rank is 208. He has completed his M.Pharmacy in pharmaceutical chemistry from prestigious Andhra University, Visakhapatnam, in the year 2003, whereas his PhD in pharmaceutical chemistry from Acharya Nagarjuna University in the year 2009. He received Fellow in Chemistry degree from Institution of Chemists, Kolkata in the year 2018. He has published 87 national and international articles in reputed and impact journals, out of which Scopus 36, PubMed 5, Web of Sciences 5, which is relevant to journals. He attains 14 patents and he has communicated 2 more patents in his research field. He is a life member of all APTI, FIS, IEO, International Accreditation Organization, and Associate Fellow of AB Academy of Sciences. So far, he has received 14 awards from esteemed organizations, such as Best Eco-Friendly Institution Award, Acharya Nagarjuna University, and AICT IICS, Institutional Innovation Council, that is from AICT New Delhi in the year 2018. And Best Publication Award from the Hyderabad in 2016. And also he secured grants, total grants, the 6 grants received from AICT and DST and ICMR and TB Association of India, which is worth of 48 lakhs. And also received 1 lakh rupees from organizing secretary from DST also, and received grant from AICT to conduct PMKUA classes at Nirmala College of Pharmacy for 3 programs, which is worth of 32 lakhs. And also he received maximum amount of 29 lakhs 50,000 rupees from the AICT in 2000 from November 2019. He received a grant from 1 lakh rupees from ICMR, and he received a short-term project grant of 25,000 also. And he received a maximum grant 12 lakhs rupees from AICT under model of scheme for Nirmala College of Pharmacy. And he received 3 lakhs 47,000, and also he received several amounts from different organizations. And he has guided 5 PhD candidates, 36 M.Pharm, 4 PharmD, and 75 B.Pharm candidates. At present, he is guiding 7 PhDs and 3 M.Pharm and 4 PharmD candidates. And he published 5 books, and one is printing. And he has a research gate score also 23.2 citations, 405 citations. And like this, I know him very well from past 15 years. So he is a good friend of me, and he is a good administrator and upload graciously ambience with the eminent professionals of national and international universities also. And I perfectly say that he is a good academician also, so that the Nirmala College of Pharmacy nowadays, this is one of the top college in Andhra Pradesh and Telangana. So I am very much thankful to my friend Dr. S.K. Abdul Rahaman as giving this opportunity, and management also I am very much thankful to you. And I wish the national webinar very grand success. Thank you very much. Thank you very much.
Thank you, Dr. Venkateswara Rao, Principal, St. Mary's College of Pharmacy, Guntur, Andhra Pradesh, for your generous introduction of mine. It is a great privilege to be a key speaker for the national webinar on orientation of graduate pharmacy aptitude test GPAT and career prospectives in pharmacy profession, organized by our Nirmala College of Pharmacy, Mangalagiri, Andhra Pradesh, India, in collaboration with Association of Pharmaceutical Teachers of India, APTI, Andhra Pradesh State Branch. Myself, having vast experience regarding training GPAT aspirants since 2009. Through my guidance, more than 2,000 candidates qualified in All India level GPAT examination. I got qualified GATE, now it is called GPAT, 3 times in the year 2000, 2001 and 2002. My best rank is 208. Dear delegates, because of qualifying All India GATE examination with a rank 208, I was able to join in one of the prestigious university, Andhra University, in the Pharmaceutical Chemistry department. I am very much thankful to my esteemed teachers for their relentless efforts for making me to who I am today. Thank you. Now we are moving on to the presentation, orientation on graduate pharmacy aptitude test, GPAT, and career perspective in pharmacy profession. This program is organized by our Nirmala College of Pharmacy, Mangalagiri, Andhra Pradesh, India, in collaboration with APTI, Association of Pharmaceutical Teachers of India, Andhra Pradesh State Branch. Now, what is GPAT? GPAT is a graduate pharmacy aptitude test. It is a national level examination conducted by All India Council for Technical Education, AICT. It is every year organized as per the directions of Ministry of Human Resource Development, MHRD, Government of India. Upon qualifying this GPAT examination, all the institutions select suitable pharmacy institutions for admission into Master of Pharmacy program. It is a 3 hours computer-based online examination which is conducted in a single session. So if you can take other examinations, we will be having 2 sessions. Morning session, there is a subject session will be there. In the afternoon session, generally they used to conduct on like general knowledge, aptitude tests, like that it is there. But in GPAT examination, purely subject based competitive examination. This GPAT score is accepted by all AICT approved institutions, university departments, autonomous colleges and affiliated colleges. Upon qualifying this all India level GPAT examination, you will be getting a financial assistance in the field of pharmacy. There is a lot of scope by qualifying this examination. Now coming into the plan of this GPAT 2021 plan. Most of the students and faculty, they are in the dilemma that whether this GPAT 2021 examination is conducted or not. All the examinations will be conducted as per the scheduled plan only. So there is no second thought in that. You must be thorough in the preparation of this GPAT syllabus for attempting online GPAT examination 2021. Opening of registration first week of November 2020. The closing of registration 15th December 2020. You will be getting this admit card to write the GPAT examination 2021, 4th week of December 2020. The online GPAT examination is conducted 4th week of January 2021. If you can take earlier GPAT conducted, the dates every year 4th week of January only it has been conducted. So coming this academic year also GPAT examination is going to be conducted in the month of January 4th week 2021. Answer key of the same examination will be released first week of February 2021. The GPAT results announcement of 2021, second week of February 2021. Now if we can see this all India level GPAT examination, how many, there is so many doubts from the students. How many questions will be there? What type of questions will be there? It is conducted for how many marks? What is the cutoff mark of this GPAT examination? GPAT, a total number of questions 125. The type of questions will be there in GPAT competitive examination. All the questions are in objective type. It is conducted for 500 marks. It means 125 questions, each question carries 4 marks. 125 into 4, 500 marks, this examination is conducted. You have to remember that there is a negative marking also in the GPAT examination. Each question negative carries 1 mark. So students, you have to be very careful while attempting the questions. So somebody, they may be hurry, they wanted to attempt almost all the questions. Thereby some students may be getting negative marking also. So that you have to be more confident when giving right answer to the question, because there is a cutoff mark. If If you can cross the cutoff mark, then only you will be going to qualify the same GPAT examination. So as per our experience, as per the earlier data, GPAT cutoff mark for open category students 130 to 140 marks approximately. Whereas OBC candidates, this cutoff mark 120 to 130 marks will be there. And SC/ST candidates 110 to 120 marks may be the cutoff. So students, you have to remember the date of registration, then closing the registration, GPAT exam date, announcement of results, and the type of questions present in this GPAT competitive examinations. Total number of questions, total marks conducted for the examination. So you have to be very careful and right. So you have to remember all the dates. Now coming into the student mindset. Yearly around 50,000 graduates B.Pharm students applying to the All India GPAT examination. Out of 50,000, GPAT qualifying cutoff mark will be given up to 3,500 to 4,000 members. It means most of the students, they may think that out of 50,000, 3 to 4,000 is going to be qualified. So there itself, they will be going to be right. So withdraw this examination. It is not like that. You have to be very, very sincere. You have to be more hardworking. You have to be more careful while attempting the examination. So here, out of 50,000 students, 50% of the students, just they are applying the application. It means 25,000 competition will be reduced. Remaining 25,000, whenever notification announced by AICTE, then just they will drop the application. After applying the application, then so they will start preparing and maybe 1 week they are going to be right. So gathering the material and collecting the previous question papers like that. After 1 week, so again what happens is out of 25,000, 50% of the students again they are going to be dropped. Because nowadays students, they don't want to go for the hard working. They don't want to spend more time on their future plans. The temporary, like playing the games in the mobiles, chatting with the friends, right? Or else some students, they may be busy with their regular cement examinations, writing the records, right? So carrying out the project works like that. So because of their overload work or some other activities, they may be dropped. 50% of the student drop. It means around 10 to 12,000 students only seriously going to prepare the examination. Out of 10,000, it means 1:2 competition will be there in GPAT examination. Hence, what I wanted to tell you is, the serious, you have to be more serious while attempting the examination, while applying the examination, while enrolling in the GPAT examination. So definitely you are going to qualify the examination. So competition, finally what I wanted to tell you is, competition will be there only 1:2, right? Now so many students, what they are thinking is, So I am hardworking. So I am going to spend lot of time on GPAT examination. What will be the benefits and rewards you are going to get? So definitely you will be getting more rewards by qualifying this GPAT examination. The first thing is, so there is a 12,400 rupees per month fellowship will be getting from Government of India. And secondly, you will be getting a first priority to join in M.Pharmacy or MS Pharmacy courses in India. The same syllabus of GPAT, which is also useful to attempt PG set examinations, AP RSET. AP RSET means Andhra Pradesh Research Common Entrance Test, and other research common entrance test examinations conducting by other states. Drug inspector examinations, state and central government. State government hospital pharmacist examinations, railway pharmacist examinations, government analysts in national laboratories, etc. All those competitive examinations in which the questions will come from the GPAT syllabus only. Now coming to the one more advantage by qualifying our GPAT examination is you are eligible for NIPER JEE examination to do MS programs in national level pharmaceutical educational institutions. We have almost 8 NIPER centers in India. So if you can qualify this GPAT examination, straight away you are eligible to write this NIPER joint entrance examination. So, and one more important point here is, if we can qualify GPAT, this GPAT score is a measurement of your hard work, your dedication, your discipline, your commitment and positive attitude, etc. Right? If you can see, these are the right benefits you are going to have with the GPAT qualifying examination. The eligibility into, one more advantage we have, eligibility into PhD projects in government organization like IICT, CDRI, CCMB, ILRI. So directly some central government organizations, they will release a notification that they wanted to select the candidates mainly based upon the, if at all engineering graduates, so they will give a notification only qualifying in the GATE examination like that. So in these central government organizations, they will release a notification qualified in GPAT is given first priority. So that, so whatever I said, these are all the GPAT rewards we can say. GPAT rewards we can say. Now coming into our actual right. So whatever so far whatever I discussed, they are all comes under the introduction of GPAT, when it is going to be conducted, what are the rewards for GPAT examination, all those things we have seen. Now, what is the syllabus present in GPAT examination? You see, in B.Pharm course, around 25 subjects you may be studying in your 4 years course. Yes or not? Yes, definitely. So you are going, you might have going to study 25 subjects. So pharmaceutics related subjects, pharmaceutical chemistry related subjects, pharmacology subjects, analysis subjects, pharmacognosy, microbiology and biotechnology. So like that, so these are the subjects you are going to study in your B.Pharm course. That is why all the students whenever you are going for the preparation of GPAT, you must know what is the syllabus present in the GPAT examination. Without knowing the syllabus, without knowing the topics, so we cannot start our preparation. That is why you should know what is the syllabus present in the All India level GPAT examination. Year by year, small topics they are going to be included, and some topics is going to be removed from existing GPAT syllabus. Now this is the GPAT syllabus you are going to be prepared to qualify this examination. Already I said there is a chemistry related subjects will be there, pharmaceutics related subjects will be there, ecology subjects will be there, analysis subjects will be there, pharmacognosy subjects will be there, microbiology and biotechnology subjects will be there. Now, what I want to tell you is, I wanted to brief you. Actually, you may be having in mind that 25 subjects has to be studied, 25 subjects has to be prepared. It is very much difficult for me, so that now itself I will drop the examination. You may be having like that, but in a simple way, the entire 25 to 30 subjects I will bifurcate 5 to 6 parts. That is, there is a pharmaceutics related subjects. Pharmaceutics means pharmaceutics 1, 2, 3, forensic pharmacy, physical pharmacy 1 and 2, then pharmaceutical engineering 1 and 2. All those things comes under one part. Then second one, pharmaceutical chemistry and pharmacology. Pharmaceutical chemistry means organic chemistry 1 and 2, inorganic chemistry, biochemistry, medicinal chemistry 1 and 2, and pharmacology. So pharmacology and medicinal chemistry, both are them looking similar, because in pharmacology you are studying about the drugs and its mechanisms, side effects like that. In medicinal chemistry, what you are studying? So you are studying the same drug structures, its QSAR, and the same type of side effects. That is why we will merge medicinal chemistry and pharmacology in one part, and organic, those things will be there. It means pharmaceutical subjects, pharmaceutical chemistry and pharmacology subject. Third one is pharmaceutical analysis. Fourth one is pharmacognosy. Fifth one is microbiology and biotechnology. So like that, entire 30 subjects I am dividing into only 5 parts. These 5 parts, now we will see in 5 of the right subjects what is the syllabus which is present in the examination, right? So firstly I will start with organic chemistry. I think organic chemistry you have studied in the first year B.Pharm and second year B.Pharm, organic chemistry 1 and 2, like that. In 1, the basic the functional groups like alkanes, alkenes, alcohols, carboxylic acids, aldehydes, ketones, those things will be there. And organic chemistry 2, so there you might have studied heterocyclic compounds, then aromatic compounds, then like stereochemistry, some named reactions, those things you might have studied in the organic chemistry 2. Now we will see what is the syllabus which is present in the organic chemistry 1 and 2. So organic chemistry, if you see the syllabus here, whatever I said, those things only present. IUPAC nomenclature of alkanes, alkenes, alkynes, aldehydes, ketones, carboxylic acids, like that. Because these are the basics required. In examination, they will ask any one of the drug, and you have to pick up the IUPAC nomenclature of that drug molecule. So to pick up the proper or right IUPAC name of the drug, you should have a basics of this IUPAC nomenclature of these functional groups. Next to production and deproduction groups. So generally it is in industry, they will use this production and deproduction, right? So grouping system. Next, aromatic compounds. Then different aromatic classes like aromatic hydrocarbons, phenolic compounds, amines, diazonium compounds, aromatic nitro compounds, halides, aryl ethers, like that. Another topic is polycyclic aromatic compounds. Polycyclic means, so benzene means only one ring will be there. Polycyclic means number of rings, more number of rings are present. It may be bi or tri, like that, fused rings. Then carbonyl chemistry. Carbonyl chemistry, you know that aldehydes, ketones you have to study. Now, especially in GPAT examination, you will be getting 2 named reactions minimum in that examination. 2 named reactions. Here in carbonyl chemistry, it is mentioned around 10 to 12 named reactions. Out of 12 named reactions, minimum 2 named reactions you will be getting in examination, and you will be getting 8 marks. You are going to score 8 marks from these 10 to 12 named reactions. Earlier, right, when I was writing GATE examination in the year 2000 or 2001, like that, before 2010, you don't have a specific syllabus pertaining to the named reactions. Around 500 named reactions will be there. We used to prepare and by heart those named reactions. Which named reaction they are going to ask, we don't know. But now they have concised the named reactions around 10 to 15 named reactions. Out of which 2 named reactions will be getting. It is easy to prepare and easy to remember those named reactions. They are like Wolff-Kishner reduction reaction, Hung-Minlang modification, then Bombard-Stevens reaction, DCC oxidation of alcohols, Michael addition, Mannich condensation, Robinson annulation, Staubach condensation, Dargent's glycidic ester synthesis, Beckman rearrangement, Bayer-Willigers rearrangement, Curtius rearrangement, Wolff rearrangement, Lawson rearrangement, Willigerod rearrangement, Penacol rearrangement. So these are the around 15 named reactions are there. Out of 15 named reactions, definitely you will be getting 2 named. You see the previous question papers, right? So definitely you are going to understand. Now, heterocyclic chemistry, it is organic chemistry too. So 3-membered heterocyclic rings, 4-membered heterocyclic, 5-membered, 6-membered heterocyclic rings has to be studied. So from which also you may be getting one question. And bridged rings. Then stereochemistry. Stereochemistry is also very, very important in NIPER examination. In NIPER examination, minimum 8 to 10 questions will be asked in the NIPER examination. That is why, whereas in GPAT examination, they may be asking 2 questions in stereochemistry, right? So in stereochemistry, the basic things you have to study. So what is chirality, what is achirality, what are enantiomers, diastereomers, then RS configuration, capital D and capital L configuration. So RS configuration, you know, Register, sinister, like that, clockwise direction, anti-clockwise direction. But DL configuration is different from rotation, dextro-levo rotation, DL rotation. That is small d and small l. But here, capital D and capital L. So this is a configuration. Configuration means arrangement of atoms or groups in a molecule. So that is DL configuration. Generally, this name will be given to the natural products for carbohydrates, for amino acids, vitamins. So for if more number of chiral centers are present, then we will go for capital D and capital L configurations. So those things has to be studied, and racemic mixture. Then what is stereoselectivity, stereospecific, then what are enantiomeric compounds. So those things has to be concentrate in the stereochemistry part. Now then kinetics and thermodynamics, cis-trans, right, cis-trans isomerism, then chair boat configurations in the cyclohexane compounds. So cyclic compounds, cyclohexane, chair boat conformers, like that. Then carbohydrate, definitely you will get one question from carbohydrates. So as I said, DL configuration. So carbohydrates means sugars. Here, what are sugars? How has to be assigned the nomenclature, DL configuration nomenclature to the carbohydrates, and what are anomers, what are mutarotations, what is mutarotation, all those things, epimers, what is epimers, those things you have to study in the carbohydrates. These are all basic things. In GPAT examination, they ask very simple basic things. Amino acid proteins. Amino acid proteins, here also it is a like natural products. DL amino acids will be there, capital D and capital L. It is not a dextron levo. So amino acid classification, amino acids right. So its characters, its properties has to be studied. Then proteins, what are denature proteins? Okay, so denaturation, renaturation of proteins, and some examples of proteins, right? So those things has to be studied in the amino acids. Pericyclic reactions. So those things comes under the organic chemistry and organic chemistry 2. Now in chemistry there is a one more part, pharmaceutical chemistry. It means synthesis. It means preparing the drug molecule and study of its kinetic and dynamic studies. That is a pharmaceutical chemistry, right? So organic chemistry means synthesis of the compound or preparation of the compound. Then pharmaceutical chemistry means not only preparation. So these pharmaceutical chemists, he or she is going to be study about mechanism of same prepared compound, and also then its PK and PD studies, pharmacokinetic and pharmacodynamic studies. Then here in pharmaceutical chemistry, inorganic chemistry also one of the subtopic. There you have to study what are pharmaceutical impurities, some IV monographs, what are isotopes. In addition to that, some medicinal compounds has to be studied. That is dentifrices, then antacids, anti-caries agents, laxatives, purgatives. Those things has to be studied under inorganic chemistry. Now medicinal chemistry, study of medicines, study of drugs is going to be studied, right? So that is general anesthetics, local anesthetics, diagnostic agents, coagulants, anticoagulants, plasma expanders, antiseptics, disinfectants, sterilization agents, astringents. So those things comes under. Then anti-malarials. So infection disease causing, right? So its organisms has to be studied, and also its treatment has to be studied. That is anti-malarials, anti-amoebic agents, sulfa drugs, quinoline antibacterial agents, antimycobacterials, antifungals, antivirals, thyroid, anti-thyroid drugs, anti-allergic agents, anti-ulcer agents, proton pump inhibitors, hypoglycemic agents. What I would like to tell you some important tips here. Whenever you are preparing this medicinal chemistry or pharmacology, simultaneously you focus on medicinal chemistry as well as pharmacology. So thereby within a single material, so you do one thing, you put a you take a pharmacology book and also you take a medicinal chemistry textbook. Okay, so here you can write the name of the drugs and the structure also you can write. You have to prepare your material by your own. So in examination, what we will do? So whoever is preparing the material, we will take them and we will have a xerox from them, and then 1 day before or 2 days before we are preparing for examination, and we are writing the examination, we are passing the examination. But competitive examination, it is not like that. It is a continuous journey. It is a continuous effort. It is a like a dedication process, right? So now, like that, if you can prepare, so chemistry and pharmaceutical chemistry and pharmacology, so both are them in a single material, so then you will be more beneficial. In addition to that, there is a sedative hypnotics, neuroleptics, anti-anxiety drugs also will be there. Then antibiotics. It is also very, very important because you may be getting 5 to 8 questions from antibiotics. It may be from pharmacology or it may be from medicinal chemistry. So minimum 8 questions you will be getting from antibiotics. Antibiotics, you know that. So penicillin, cephalosporins, beta-lactamase enzyme inhibitors, monobactam antibiotics, then chloramphenicol, tetracyclines, aminoglycosides, macrolides, lincomycins, polypeptide antibiotics, anti-cancer antibiotics. So these are all comes under antibiotics, antibacterial drugs. Steroids, so corticosteroids, anti-inflammatory steroids, male and female contraceptives, anabolic steroids. So those things has to be studied. Narcotic drugs also is there in chemistry and pharmacology. Cholinergic drugs, then adrenergic drugs has to be studied. Neuromuscular disorders, Parkinson and muscle relaxant, these things has to be studied. Under cholinergic agent, nicotinic and muscarinic receptors, N and M receptor, agonist and antagonist has to be studied. Antihypertensive agents, anti-anginal drugs, diuretics, antidiuretics, prostaglandins, and in chemistry way, stereochemistry and combinatorial chemistry has to be studied. Now we are moving into the pharmacology. So pharmacology, it is basically divided into 4 groups, pharmacology subjects. General pharmacology is one, second one CNS, third one ANS, fourth one CVS. So anyhow, these chemotherapy, therapeutic agents, antibiotics, these things will be there. So then 1, 2, 3, 4, 5. General pharmacology, CNS, ANS, then CVS, chemotherapy. So from under each group, you will be getting minimum 5 questions. 5, 5, 5, 5, 5. 25 questions you will be getting from these 5 groups. It may be from chemistry questions, it may be pharmacology questions. So these 5 right, so has to be prepared, and 25 questions you will be getting. Out of 125 questions, 25 questions coming from these five areas. In addition to that, we have a small topics like respiratory system, endocrine system, GIT. These things already I explained in pharmaceutical chemistry also. Vitamins, minerals. So those things from those topics you may be getting 4 to 5 questions. So this is the thing. So but basically those 5 groups, chemistry, under chemistry and under pharmacology, you have to be right more thorough, or you have to focus on those 5 topics. Then coming into the pharmacognosy subject. So pharmacognosy, it deals with the study of plants. Under that, the general introduction has to be studied, classification of crude drugs, then microscopic characters, macroscopic characters, some animal products, plant products, then enzymes, pesticides, insecticides, adulteration of these plant products is also important. Then already I told microscopy, and biogenic pathways in carbohydrates, lipids, tannins, volatile oils, resinous drugs, glycosides, alkaloids, phytopharmaceuticals. So those things. Here, in addition to that, herbal formulations, herbal cosmetics, traditional herbal drugs, these things also has to be studied. But they may be asking 1 or 2 questions from herbal related, whereas more number of questions getting from so those important things like biogenetic pathways, then alkaloids, glycosides, volatile oils, tannins, terpenoids. From these areas you will be getting questions under pharmacognosy 1 or pharmacognosy 2. So both of them merged. So this is the syllabus under pharmacognosy. Then pharmaceutical analysis. Pharmaceutical analysis, I think students, you have studied pharmaceutical analysis 1 and pharmaceutical analysis 2. 1 is coming in the first year B.Pharm. Pharmaceutical analysis 2 is comes in the fourth year B.Pharmacy. But here analysis 2 is very, very important compared to analysis 1. So around 10 to 12 questions you will be getting from pharmaceutical analysis, right? So pharmaceutical 1, you may be getting 3-4 questions. Whereas pharmaceutical analysis 2, from that you may be getting around 8 to 10 questions you will be getting. So now coming to the pharmaceutical analysis 1, what you have studied, what is the syllabus? Like titrations, under titrations, so many titrations you have studied in the B.Pharmacy first year. Acid base titrations, non-aqueous titrations, oxidation reduction, precipitation titrations, complexometric titrations, gravimetry, potentiometry, like that. Diazonium titration, Geldal nitrogen estimation method, correlation method, these things. Out of these titrations, you may be getting minimum 1 to 2 questions you will be getting from the titrations, right? And especially all the titrations, minimum you have to write, minimum you have to prepare. Then analysis 2 is very, very important. So that is why I told. So from analysis 1, you may be getting 2 to 3 questions. Analysis 2, you will be getting 8 to 10 questions. Like spectroscopy. Spectroscopy, of course, analysis 2 deals with the quality and quantitative analysis. Spectroscopy, under that UV visible spectroscopy, spectrophlorimetry, flame photometry, then IR spectroscopy, NMR, mass. So these principles, instrumentation, what are the components present in the instrumentation, applications of, specific applications of, for example, you take IR specific application is a functional group determination. So like that specific application you have to know, and instrumentation and its components you have to know, and basic principle you have to know. So that is a spectroscope. Spectroscopy, minimum you may be getting 3 to 4 questions. Then electroanalytical chemistry like pulverography, nephelometry, turbidometry, those things will be there. 1 questions you may be getting from that. And chromatography. Chromatography, it is a separation process, separation of drugs, or determination of quality or quantity of the drugs. There you have to study about the TLC, paper chromatography, column chromatography, GC, HPLC, HPTLC, those things. In addition to that, small definitions of what is Van diameter equation, what is plate theory, what is resolution, those definitions also be prepared and studied. Lastly, electrophoresis and the sampling techniques, those things also comes under the analysis. Analysis, dear students, analysis we have studied 1 and 2, both of them you will be getting from both of the subjects, you will be getting around 10 to 12 questions. Now another like subjects, biochemistry, 2 questions, biotechnology 5 to 6 questions you will be getting. So biochemistry, cell, what is cell, what are carbohydrates, what are proteins, vitamins, what are enzymes, nucleic acids, those things you will be studying in the biochemistry. The cycles will be there in the biochemistry. What is glycolysis cycle, Krebs cycle. Okay, so those cycles has to be studied. Okay, and urine analysis, blood analysis, those things also be studied. In biotechnology means you are going to study about the cell, plant and tissue cultures, then fermentation technology, recombinant DNA technology, PCR application. PCR nowadays for every test we are using PCR. So PCR applications also is important. Next, some immunological products has to be studied. Okay, so dear students, don't worry. Lastly, I will cover what are the right textbooks has to be, standard textbook has to be followed, material to be prepared from those standard textbooks, right? So now just I am highlighting the topics which are present in the individual subjects, right? So in microbiology, you know, microscopy, staining techniques, what are different fungi, viruses, or aseptic techniques, sterilization process, Sterilization process also is important. From that you may be getting one question. So hot air oven sterilization, autoclave sterilization, right? Gamma radiation sterilization. So from that you may be getting one question. Staining technique is also important. Then vaccines, some microbiological assays. Suppose one right, one antibiotic is there. So which is produced from which microorganism? What is the microorganism? Produced microorganism and testing microorganism for that antibiotic. So those things also be prepared and gather the material. Then clinical pharmacy and therapeutics. So this is actually from last 2 years only it has joined. Earlier this subject is not there. As per the new regulations of Pharmacy Council of India, these pharmacy practice subject, therapeutics, pathophysiology, these subjects also joined. So I think you are the first batch, 2017 batch, so that these topics also included in the GPAT examination. So clinical pharmacy and therapeutics. Here clinical trials, various clinical phases, phase 1, phase 2, phase 3, phase 4, like that. Therapeutic drug monitoring, ADR, drug-drug interactions. Next, pharmacovigilance. What is pharmacovigilance? Nutraceuticals. Then treatment regimen. Like in pharmacology, just you are studying about drugs, its mechanism. You are not stressing about what is the dose has to be taken, how many times it has to be taken. Those things you are not covered in the pharmacology. Whereas here in therapeutics, you have to cover the therapy. So dose dosings also you have to be prepared, and medical errors also you should know. And then I said that is a pathophysiology subject will be there, cell injury, the mechanism of inflammation, acid-base balance, WBC, RBC, immunologically, immunopathology, infection diseases, neoplastic diseases like cancer diseases. So pathology of some other diseases. Those things we have studied in the first year B.Pharm. Pathophysiology, second semester you have studied. So liver and kidney function tests, liver and so like ALP test. Okay, so those things has to be studied. Kidney tests has to be studied, and these things also you have to remember. Like urine analysis, blood analysis also you have to remember. Human anatomy, physiology. From that also you may be getting two questions. HAP, like cell physiology, what is blood components, respiratory system, ANS system, sense organs, central nervous system, urinary system, some reproductive glands, cardiovascular systems. Those things we have to write. So the basics and the structural features of human anatomy has to be studied, right? So this is about the things. And lastly, pharmaceutics related subjects. In pharmaceutics, it is a study about the dosage forms, right? So how to prepare the dosage forms and what are the various biological products here present. Pharmacy industry, the plant, location, layout of that pharmacy, the industry or pharmacy, whatever maybe it is, and what are capsules, what are tablets, powders, right? Its method of preparations, its applications, all those things, parenterals, these things are studied. In addition to that, the liquid formulations like suspensions, emulsions, then another one suppository, semi-solids, those things has to be studied. Aerosols, ophthalmic preparations, then prolonged action pharmaceuticals like NDDS, novel drug delivery systems. Under that you have to study sustained release and controlled drug delivery systems like that, GMP and validation, cosmetics, pilot plant scales, those things. This is and all comes under the pharmaceutics. Dear students, in coming slides, I am going to explain you about the number of questions shared into individual subjects. That is also I have covered. And what are the textbooks has to be covered. Those things also I have covered in coming slides. So now just I am highlighting about the topics which are present in the entire GPAT syllabus. In physical pharmacy or physical chemistry, viscosity, rheology, surface and interfacial phenomena, dispersion systems, complexation, buffer, solubility, colligative properties, thermodynamics, Ri, refractive index, solutions, then ionic equilibrium, kinetics, those things you have studied in the physical pharmacy 1 and 2. Then under pharmaceutics, we have another subject, that is a biopharmaceutics and pharmacokinetics. Biopharmaceutics, I think it is coming in the fourth year B.Pharmacy, study of ADME. So ADME means absorption, distribution, metabolism and excretion of the drug. Whichever drug you have administered, its ADME has to be studied under this subject, that is biopharmaceutics and pharmacokinetics, right? Bioavailability of drugs and bioequivalence studies. And another one is a pharmaceutical engineering. Pharmaceutical engineering 1 and 2 will be there. So the most important textbook is a Badger you have to follow. Somehow I have covered that slides also, the textbooks. Here what is heat transfer, evaporation, distillation, size reduction, size separation, extraction, crystallization, filtration, centrifugation, humidification, refrigeration, those things has to be studied. So in which the structures, different type of dryers, different type of distillators, different types of size reduction, the types has to be studied, its principle, its application has to be studied, right? So then in addition to that, so material for construction, then the automated controlling systems, industrial hazards and safety precautions. From that they may not ask the questions, but they will ask the questions from size reduction, size separations, distillation, evaporation, some extraction techniques, filtration formula, those things maybe asking the questions. Then another one is under Sutix, one more subject it is there, pharmaceutical management. So the pharmacy graduate, he not only having the subject knowledge in these preparations, dosage forms, mechanisms and those calculations, all those, in addition to that, the promotion of the products. Promotion of the product is also important. So filing of the product is also important. Filing. So those things also you should have the knowledge, right? So introduction of the management, planning, forecasting, organization, management, inventory management in the pharmacy or in the hospital or in the pharmaceutical industry. So marketing skills should be there. You have to study in that. Leadership topic and motivation, those things also I think you are studying in the pharmaceutical management subject. In addition to that, you should know what is GATT, then what is WTO, World Trade Organization, TRIPS, trade related intellectual property rights. These abbreviations, these small description you should know, right? US FDA, ISO certification, CDSCO, ICH, WHO, those things also should know. Okay. So far, I have discussed about the GPAT syllabus, right, which is present, right, in the competitive examination. Now I am going to I think it is a journey of GPAT syllabus. The entire GPAT syllabus journey is 25 to 27 slides. If you can go through the internet, Google search, you just go and type GPAT syllabus. Definitely you will be getting around 40 pages. 40 pages you will be getting. That is only syllabus. First of all, syllabus you have to know, and what are the important topics has to be more focused, and what are the more important topics, more stressed. Those things also very important. Those things just I discussed in previous slides. Now coming into the important part, dear students, if you have paper and pen, so you can note down, this is very important subject priority in GPAT examination. So I divided entire GPAT into 5 parts. One part is pharmaceutics, second part is chemistry and pharmacology, third part is pharmaceutical analysis, fourth part is pharmacognosy, fifth part is biotechnology. So these are the 5 parts, entire 25 to 30 subjects we have to take into a 5 parts. The first part, that is a prime and most important part, and most of the pharmacy graduate, they are very much fond of studying this pharmaceutic subject. That is purely, you may think that it is purely belongs to our profession. So that is why pharmaceutics is very, very important under GPAT examination. So around out of 125 questions in the GPAT, 45 questions you will be getting from pharmaceutic subject only. 45 questions you will be getting from pharmaceutic subjects. Pharmaceutics means it is not only one subject. Pharmaceutics means, right, it is a merging of few more subjects. Pharmaceutics 1, 2, 3, biopharmaceutics, physical pharmacy, pharmaceutical engineering, and forensic pharmacy. Forensic pharmacy also, dear students, forensic pharmacy is also important. Minimum 2 questions you will be getting from forensic pharmacy. What are the schedules, A to Z schedules you have to study, forms you have to study, and some acts has to be acts. Highlight the acts. Act, Magic Remedies Act, Pregnancy Termination Act, Narcotic Drugs Act, Pharmacy Act. Those things has to be just remember from forensic pharmacy subject. It means from pharmaceutic subject you will be getting 45 questions, right? Plus or minus 5. So you may be getting 50 questions, or sometimes 40 to 45 questions you will be getting. Next, another part in the GPAT, that is a pharmaceutical chemistry and pharmacology. So around 50 questions you will be getting, dear students. 50 questions. You can't imagine pharmaceutical, most of the students in pharmacy profession, so they feel tough this pharmaceutical chemistry and pharmacology, right? But it is not like that. If we can show, if we can put serious efforts, definitely you are going to, right, learn the pharmaceutical chemistry and pharmacology subject. Earlier I said, so both of them is looking same, just a small difference will be there in both of the subjects, right? So here 50 questions you will be getting from pharmaceutical chemistry and pharmacology subjects, right? Here coming into the subjects which are present in the chemistry and pharmacology. So organic chemistry 1 and 2, biochemistry, medicinal chemistry 1 and 2, pharmacology 1 and 2, then HAP, pathophysiology, pharmacotherapeutics. These are all subjects comes under chemistry and pharmacology, right? Mainly you have to focus on medicinal chemistry and pharmacology, right? In organic chemistry, already I told, from named reactions, out of 12 to 15 named reactions, you will be getting 2 named reactions. So you can encash the questions simply by preparing and by adding those 12 named reactions, which is in the carbonyl compounds, right? So pharmaceutical chemistry and pharmacology area, you will be getting 50 questions. Then another right part is pharmaceutical analysis. Already I told 1 and 2, pharmaceutical analysis 1 and 2. 1 which contains titrations, 2 which contain right, like spectroscopy, chromatography, right, electroanalytical techniques, like that. So pharmaceutical analysis 10 to 12 questions. Earlier also I told. And pharmacognosy or phytochemistry, right? So 10 to 12 questions you will be getting from the pharmacognosy. 10 questions plus or minus 2. Biotechnology 8. Biotechnology and microbiology, both of them includes 8 questions plus or minus 2. So like that, the subject priority and questions will be asked in the GPAT competitive examinations is like that. Once again, I would like to stress, from pharmaceutics, 45 questions you will be getting. Pharmaceutical chemistry and pharmacology you will be getting 50 questions. Pharmaceutical analysis you will be getting 10 questions. Cognosy you will be getting 10 questions. Biotechnology 8 questions. If we can calculate all the questions, around 125 questions will come it is going to be going to be asked in the All India level GPAT examination. Now, under GPAT competitive examination, lastly, I would like to tell you the most important and most standard textbooks to be referred for gathering the material, for preparing the material. They are Pharmaceutics 1, 2, 3 material has to prepare from Lackman, Alton and Ansel. These are the three foremost important important textbooks. These books definitely available in your library, so that you can take these textbooks and prepare the material for Pharmaceutics 1, 2, 3. Physical Pharmacy 1 and 2. You know the Martin textbook. C.V.S. Subramaniam, both are the suggested textbooks to prepare Physical Pharmacy and Physical Pharmacy 2. Pharmaceutical Engineering, Badger and Sambamurthy. Forensic Pharmacy, so you can prepare it from N.K. Jain, B.M. Mithal, Guruprasad Mahanta. These are the preferred textbooks. Forensic Pharmacy, just I told, schedules, forms and some acts, those things has to be studied. Biopharmaceutics, Brahmankar is one of the preferred textbook. G.R. Chetwal, N.K. Jain. These are the textbooks for the biopharmaceutics. Organic chemistry, Jerry March, Marson Boyd. So these are the preferred textbooks for the preparation of organic chemistry. Even though named reactions also available in that. Next, biochemistry, Leninger and U. Satyanarayana. So these books are important for preparing the material, biochemistry. Next, medicinal chemistry, the most important textbooks are William Foy and Wilson Giswold. These are the preferred textbooks. Now coming to the pharmaceutical analysis. Pharmaceutical analysis, B.K. Sharma, Y.R. Sharma, William Kemp, Robert Silverstein. So these are the preferred textbook for pharmaceutical analysis subject. Then pharmacology 1 and 2. So pharmacology 1 and 2 is Rangandale, Kadjang, K.D. Tripathi. So these are the books, preferred books for pharmacology 1 and 2. Then pharmacognosy, C.K. Kokate, E. Vallis and Present Evans. These are the preferred textbooks for pharmacognosy subject. Then microbiology, Pelger and Anantanarayana. These books. Then biotechnology, H.K. Das, Satyanarayana and R.C. Dubey. So these are the textbooks, standard textbooks has to be referred, has to be used to prepare GPAT syllabus, to prepare the materials, right? Now, not only these standard subjects, you have to refer some more subjects, some more not subjects, some more textbooks. They are also very, very important, right? Because what are textbooks I am going to tell you now. So their ready-made material is available. You will be getting lot of questions from that. Okay. So with our experience, I am with my experience, I am telling you. So in not only preparing the materials, and the most referred textbooks for the GPAT competitive examination is NAPLEX book. I think those who are looking for abroad jobs and abroad like opportunities, NAPLEX exam has to be right? That is Shergill, Leon Shergill. That is the standard textbook. There it is a one textbook. It covers a lot of information. So from standard textbook, this textbook. So you can write, go for this Leon Shergill and collect some important material and put into your notebook. In addition to that, Remington's is also very, very important. It is available in your library, I think. Indian Pharmacopoeia, and Indian Pharmacopoeia first few pages. So yellow color pages will be there. So that is also very, very important. 4 or 5 pages will be there. From that also you will be getting the question. What is cool temperature? What is storing conditions? What is cool? What is those things, and solubility, sparingly soluble, insoluble. So how many parts, like that. So in the yellow pages, first 4 or 5 pages are very, very important from Indian pharmacopoeia. So in addition to that, dear students, what you have to do is you have to refer previous question papers. That is very, very, very important. Previous question papers. So many students, what they do is they will prepare the material, they will gather the textbooks, they will write thorough with the material, but they will miss the previous question papers. So whoever seriously preparing for GPAT competitive examination, so previous referring of previous question papers is very, very important. Around 30 previous question papers are available. Though from previous question papers, you will be getting minimum 25 to 30 questions. Dear students, once again you have to mind this word. That is, referring previous question papers are very, very, very important. Out of 30 question papers, 30 question paper means 30 into, you can take 100. 3000 questions will be there out of these 30 question papers. From these 3000 questions, you may get around 25 to 30 questions. You see how much benefit you are getting. 25 into 4, 100 marks. So from previous question papers itself, you will be getting 100 marks. Or if luckily if you can get 30 to 40 questions, you see simply from previous question paper itself, you are going to qualify all India level examination. That is why, so along with your textbook material preparation, by hearting the things, you must prepare this previous question papers. That is N. Enamdar. This is one of the book. There previous question papers are available. Pearson textbook, Vidyasagar textbook, Muhammad Ali, so etc. These are the textbooks. So now in the market or in your library to refer previous question papers. Yes. So this is about our GPAT, Graduate Pharmacy Aptitude Test. Now I think after this presentation up to this level, sir, we have gone through the entire syllabus present in the GPAT. Now itself we wanted to drop because so much syllabus is there. You are saying that 50 pages syllabus is there. When we will prepare, when we will plan all those, like that. But so in every examination, it may be competitive examination or university examination, or it may be interview, job interview. So without your valuable time, spending of your valuable time, your hard work, right? So your dedication, your commitment, your sincerity, right? So you never achieve the goals and aims. Yes, you will be know that. That is why, my dear delegates and my dear student friends, you have to be very careful while preparing the material, right? And these are the important content sharing and information, right? So because of my experience, having lot of experience from so I got qualified GPAT examination with 208 rank. I qualified this GATE examination 3 times. 3 times I qualified all India level examination. I got admission in Andhra University. That time only 2 colleges are there. So Andhra University and Kakati University. Now so many colleges are there. One more point I want to tell you, especially in Andhra Pradesh, those students are from Andhra Pradesh, the delegates from Andhra Pradesh, you have to remember one word, that this academic year onwards, you may be you may not be getting a PG scholarship from the government. So I am not so telling you, but so we are listening the words from the government, like this academic year onwards, there may not be having any fees reimbursement program to the PG students. So this is also, you have 6 months time, 5 months time, 5 months time to attempt all India level examination. If you can attempt the examination, you will be getting more rewards. Okay, so this is a lifelong certificate. If you can qualify all India level examination, so it measure your right. So in the rewards and the importance of GPAT, there I said already. I said there. So lifelong, it is a recognition of your dedication and your hard work. Okay, so your performance, right? So that is why, my dear students, now today itself you can plan, you can prepare the schedule, right? So daily minimum you start your GPAT preparation journey 3 to 4 hours. 3 to 4 hours. Then definitely, right, you will be getting the things, right? So automatically you will be getting the confidence, right? That confidence will boost you, right? And definitely you are going to qualify the examination. Now we are coming into the second phase of our webinar, that is career opportunities in pharmacy. So in first part and first phase, we have purely focused on GPAT, its GPAT examination, its importance, then syllabus, then the subject sharing, the mark sharing, the test books to be referred, and some tips to qualify the GPAT examination. So tips means the referring previous question papers and some most important test books. All those things we have discussed in the first phase of our national webinar. Now we have entered into a second phase of our second part of our webinar, that is career opportunities in pharmacy, right? Now most of the students joining in pharmacy courses because of not getting MBBS or veterinary or dental, these admissions, right? Myself also, I have joined pharmacy course without my knowledge and without having proper guidance, right? So just I have joined in the pharmacy. You people also, most of them, not intentionally, unintentionally, you have joined because of force of your parents, right? You might have joined in the pharmacy, beginning of our pharmacy program, right? So you maybe felt that this course, this profession will give a bright future or not, right? So now you are going to finish the pharmacy program. After that you are in the right searching for the jobs, right? And of course some of the students, you might have getting a opportunities, you might have selected in the placement drives organized by your institution and also your right sister concerned institutions or nearby colleges, right? But you have to know our profession is also having a lot of golden opportunities, right? So in olden days, when we people studied in the year 1997, I joined in B.Pharm program. I completed my B.Pharm in the year 2001. 2001 I qualified all India level GPAT examination. Then I joined then I took admission in Andhra University chemistry. subject. In 2003, I finished my M.Pharmacy program. But that time we don't have this many, we don't know and we don't have this many opportunities in pharmacy profession. But really, being a administrator, being a professional of pharmacy, I could see many developments happened in our profession, right? In terms of industry jobs, in terms of software jobs, in terms of government jobs. So we could see number of opportunities in our profession, right? So in that, so now I will highlight the job scope and career opportunities in our pharmacy profession. They are production and manufacturing, formulation development, quality assurance, quality control, drug regulatory affairs, pharmaceutical packaging and technology, R&D, research and development, hospital pharmacy, community pharmacy. Community pharmacy means opening a pharmacy outlets, right? Academics means institutions. Marketing, pharmaceutical marketing jobs, clinical research organizations, CROs. There also we have some positions like clinical team leaders, clinical research associate, clinical trial site manager. So these are all opportunities are available to the pharmacy graduates. So there is a opportunities in government sector. They are drug inspector posts, drug controllers, scientists in CSIR and ICMR, government analysts, railway pharmacist jobs, state government hospital pharmacists, banking sector, groups, civils. So these are all the government jobs are available to the pharmacy graduates. So then how we are eligible in groups and civils and bankings. I could see many of the students, my students also working in the banking sector. And two more students, my students, they are selected IPS like that, groups and civils, right? So the qualification to attempt these government jobs like banking groups and civils is degree is enough. Like it may be 3 years degree, normal degree courses, or B.Tech, or 4 years or pharmacy course. So all those degrees are eligible to attempt these banking examination, groups, civils, like that, right? So some students, they may not be knowing about this. So are we eligible for banking? Are we eligible for groups and civils, like that? So most of them, most of our pharmacy professionals, so they are in the banking sector, group, civils, right? And coming to the another opportunities, that is regulatory bodies like PCI, AICT, UGC. In these areas also we will have a good opportunities. And Indian Pharmacopoeia. So recently I received a call from my alumni student. So he got the job in Indian Pharmacopoeia. So that notification released in the year 2017. So recently, just 10 days back, I received a call from him. Sir, I applied this IP, Indian Pharmacopoeia. It is located in Delhi, Ghaziabad, Indian Pharmacopoeia, right? So presently, the same student alumni, he is working in US Pharmacopoeia, right? So it is anyhow, it is a private organization only, but he got the government opportunity. Nobody is not knowing about that. So when I received a call, I know about this. Indian Pharmacopoeia is also giving opportunity to our pharmacy professionals, right? So that is also one golden opportunity, right? Starting salary around he told me around 80,000 per month, right? So next, chemist shop, like pharmacy outlets also we can open, and we can have our own business. And if you have a good marketing strategies, you definitely you will be very much successful in right, in your own pharmacy. Next, entrepreneurship also, like our own business, like opening the pharmacy, and then your own right, small scale industry you can open, or else you can work as a CRO. You can open your own CRO, clinical research organization, right? So this is like entrepreneurship. Okay, so your own business. Abroad opportunities. So definitely in lot of scope is there in abroad. Like most of the students upon like end of the B Pharmacy program, so they are looking for attempting this GRE, TOEFL and IELTS they are writing, and they are going to the abroad. There they are pursuing their MS program, followed by jobs like that. So many students are there. So many students are working as employee in abroad. So either in the community pharmacy means working in pharmacies, outlets, and some of the students they are working in hospital pharmacy, hospital. Some of the students they are working as employees in industries located in abroad. So like that, in abroad opportunities, we will divide into three parts. Industry sector is there, then hospital pharmacy is there, then another one is a community pharmacy. So initially they are going for studies, followed by job opportunities. Then after B Pharmacy, I being a senior pharmacy professional, I suggest B Pharmacy graduate. You can go for higher studies. You can go for higher studies, like continuing your education, PG followed by PhD, because after completion of B Pharmacy, some students, because of parent force, they may be joining in some small scale industries, or then they may work in some outlets, and they may be joining in some industries like that doing. But when going for the promotions, okay, so when to lead the position in the same organization, right, you must have a good qualification. Like higher education is very important to lead good life in the society, right? So earlier we used to see white collar job means, so the qualification is there, so definitely you will be getting a white collar job. It means you will be getting a good salary, and you definitely you will be getting a right, good positions, right? You will be recognized, you will be awarded when you right. So continue your education, that is for higher studies, PG, M Pharmacy or MS. It may be neighbor MS or abroad MS, then followed by PhD or postdoc also is available. Coming into the software opportunities. So when we were in the right studies, when we were in the beginning of our career, so we don't know the software opportunities are also there for the pharmacy graduates or pharmacy professionals. We don't know exactly. So from the past 10 years, so actually I am having 18 years of teaching as well as research experience. So but past 10 years, I also knowing about the software opportunities, and vigorously it has right, so come up to the pharmacy professionals. So they are pharmacovigilance top most software companies, they entered into the pharmacovigilance and clinical data management, medical coding, like that. So topmost MNCs like Novartis, then Accenture, Quintiles, so IQVI. So these are all top companies in software and also in our right now they have entered into our pharmacy profession. So right, so they are all MNCs, right? Pharmacovigilance, clinical data management, CDM you can say, then medical coding, medical scribing, medical transcription, medical writing, scientific writing, SAS means statistical analytical systems. SAS also a golden opportunity to the pharmacy graduates. Excellent salaries will be given, right? And some journal publishers and conferences like that, WOMEX, and some organization links like that, some organizations are there. So they will publish the articles as well as they organize the conferences in India and also abroad. So like that, this is one of the opportunity. Like that, we have a plenty of opportunities in software sector. And we have other opportunities also, like nuclear pharmacy, forensic pharmacy, army services. And so army services notifications also will come. So these are all other opportunities to our pharmacy professionals, right? So now coming to the end of my presentation, right? So today's national webinar, I am very much happy. Because I am heartfully sharing my knowledge, my experience, my expertise, so my skills to all my students, delegates, and my staff and my friends in this online platform, right? And then I think all the delegates, you understood the right this presentation. So this presentation was started with the definition of GPAT, from then plan of the GPAT, then syllabus of the GPAT, then subject marks sharing in the GPAT examination, then what are the standard books to be referred, what are the important tips and previous question paper importance, all those things I shared. And second part of my presentation, like the career opportunities. So these things also I, as per my knowledge, I have shared to all the delegates. So so it has given me right an excellent opportunity. So finally, I thank my mentors, my management, my staff members, and my student friends, and all the delegates. So thank you very much. Thank you one and all. God bless you. Have a good day.
Thank you, sir. I would like to request Mr. M. Prashanti, Department of Pharmaceutical Analysis, for addressing vote of thanks.
Honorable dignitaries and delegates, it's my privilege to propose the vote of thanks on behalf of this esteemed institution. We want to express our gratitude to Reverend Sister K. Sundari Garu for delivering the presidential address and grace this occasion with her presence. I extend our sincere thanks to Reverend Sister P. Alfonsa Garu, Secretary and Correspondent, for being our backbone in our endeavor and constantly motivating and inspiring us. I would extend my wholehearted gratitude to Dr. G. Deval Rao Garu, President of APTI, AP State Branch. A warm thanks to our resource person, Dr. Sheikh Abdul Rahaman Sir, Principal and Professor, Nirmala College of Pharmacy, for the vision and commitment to work and making this webinar very fruitful and beneficial for the whole student community and faculty. I would like to take a moment to acknowledge the Organizing Secretary, Dr. K. Shantakumari Madam, for her immense contribution for making the program successful. My heartfelt thanks to Chief Person, Dr. P. Venkateswar Rao Garu, Principal and Professor, St. Mary's College. Finally, our sincere thanks to the faculty of Department of Pharmaceutical Analysis and our delegates for making the program successful. Thank you one and all.